Hi everyone, welcome to Rescue Medic. Today, I'll show you step-by-step how to perform CPR, cardiopulmonary resuscitation, a simple technique that can save someone's life in an emergency. Whether you're a healthcare provider or a bystander, this knowledge is life-saving. Let's begin. Imagine you find someone collapsed and unresponsive. What do? Let's go through the steps of CPR. First, make sure the area is safe for both you and the victim. Then, check if the person responds by tapping and shouting, "Are you okay?" If there's no response, call for emergency help immediately. If you're not alone, ask someone to bring an AED, an automated. Step 3. Check breathing. Tilt the head back, lift the chin. Look, listen, and feel for breathing for 10 seconds. Check for normal breathing, look for chest movement, listen for breath sounds, and feel for air. Step 4. Start chest compressions. Place heel of one hand on center of chest. Place other hand on top. Interlock fingers. Place your hands in the center of the chest and push hard and fast. 30 compressions at a rate of about 100 to 120 per minute and about 5 centimeters deep. Step 5. Give rescue breaths. After 30 compressions, give 2 rescue breaths with the help of BVM or by mouth-to-mouth ventilation. Each breath should make the chest rise. Tilt the head back again. Pinch the nose. Give 2 breaths, watching the chest rise. Continue CPR. Keep repeating 30 compressions and 2 breaths until emergency help arrives, an AED is ready, or the person starts breathing. Step 7. Using an AED. If an AED is available, turn it on and follow its voice prompts. It will tell you when to deliver a shock or continue CPR. Review. CPR is a life-saving emergency procedure performed when a person's heart stops beating or they stop breathing. It helps keep blood and oxygen circulating until advanced medical help arrives. Purpose of CPR: to maintain blood flow to vital organs, especially brain and heart, to increase survival chances after cardiac arrest or respiratory failure. When to start CPR? Start immediately if the person is unconscious, not breathing normally, no breaths or only gasping, no pulse, or you are unsure how to check it. Steps of CPR. Adult. Remember, C, A, B. C, compressions, A, airway, B, breathing. 1. Check responsiveness and call for help. Tap and shout, "Are you okay?" If no response, then call emergency services. Ask for an AED defibrillator if available. 2. Check breathing. Look, listen, and feel for breathing for 10 seconds. If not breathing, start CPR immediately. 3. Chest compressions. Place heel of one hand on the center of the chest, other hand on top. Push hard and fast, at least 5 centimeters deep, 100 to 120 times per minute. Allow chest to fully recoil after each push. 4. Airway. After 30 compressions, open the airway, head tilt, chin lift. 5. Breathing. Give 2 rescue breaths, each about 1 second, making the chest rise. If not trained or unwilling, continue hands-only CPR. 6. Repeat. Continue 30 compressions plus 2 breaths until medical help arrives, the person starts breathing, you become too exhausted to continue. Using an AED if available. 1. Turn it on and follow the voice prompts. 2. Attach pads to the chest as shown in the diagram. 3. Ensure no one is touching the patient during analysis or shock. 4. Continue CPR when instructed. Special notes. For children and infants, techniques are slightly modified, less force, smaller breaths. Always ensure scene safety first. CPR should be performed on a firm, flat surface.
That's how you perform CPR. Simple steps that can truly save a life. Don't forget to like, share, and subscribe to Rescue Medic for more emergency care tutorials. Remember, knowledge saves lives.